I'm just going to start us off today by introducing the topic of food deserts. Maria, if you could hit the next slide. So what is a food desert? Simply put, it is a geographic area where residents' access to affordable, healthy food options, particularly fresh fruits and vegetables, is restricted or non-existent due to the absence of grocery stores within convenient traveling distance. I've highlighted a few important words there. The food has to be affordable and healthy, and it has to be within convenient traveling distance. If you do not meet all three of those criteria, then you are living in what can be classified as a food desert. There are a few reasons that something like this might happen. Poor public transportation, particularly in very urban areas, makes it very difficult for people that don't have access to cars to get to grocery stores, particularly if they're over 1 mile away. When planning for where to place grocery stores, certain communities are overlooked because of the way that the government classifies the counting of retail food stores. So if you have a small corner store which sells mostly liquor and then packaged foods like, say, crisps or frozen meals, that would be counted as equivalent to having something like a Kroger or a Safeway in your neighborhood, even though you don't actually have the same access to groceries that someone living next to a Kroger would. Also, this is a larger issue that is a little bit more difficult to address, but certain economic forces have driven grocery stores out of cities in recent years. This, once you think about certain aspects of intersectionality with redlining and then the perception of what it means to run a business in a lower income neighborhood, ties in very heavily to the way that people of color and minorities are treated in cities and the different health outcomes that happen because of our infrastructure. So just to sort of really bring this home, like this is an issue that is affecting people most likely that you know and that live near you. Maria, if you could hit the next slide. I'm going to show you a graphic of food deserts in Cincinnati. So that is Cincinnati. Maria, if you can point out the Coreyville Kroger, it's like right in the middle, that little blue dot, a little bit further down. Yeah, you just like, yeah, a little bit right there. So that is where UC's campus is. That is the Coreyville Kroger. And as you can see, while Coreyville and CUF is pretty well served, there are plenty of neighborhoods right around us that are a combination of people living in low income areas and with low access to transportation. For people who do not own a car, many times their best option is the bus. So if you can hit the next slide. This is a map of those same grocery stores and how far they can serve people who are less than 15 minutes away by bus. So again, this looks a lot better, but there are still these dark black areas where people just do not have access to grocery stores within convenient traveling distance. And so as we're going through this presentation, start to think about how large of an area this is, how many people living in a city as densely populated as Cincinnati, how they might be affected by not having ready access to affordable, healthy meals, and what that might do to them in their daily life, what that might do to their children. Yeah, there's a lot to think about. We're going to talk about lots of different aspects of this issue, so I'll hand it over to Anish now.
Yeah, so just to transition in, I wanted to look at food insecurity on an international scale, specifically with our partners in Thailand and the border of Thailand. So during the COVID-19 lockdown, which happened around March, early April in Thailand, a lot of migrant workers were forced to leave the country to go home. And it is the second largest economy in Southeast Asia for food produce. And most of the workers, if not like, I want to say around 85% of workers in certain food areas are consistent of primarily migrant workers. So you need a constant stream of migrants in order to keep the food industry thriving, and that just didn't happen because of COVID. And then they've had the worst drought that they've ever seen in the last 40 years. So combine those two, and the price of rice has tripled, and vegetable and eggs price is also increasing. So just to think about food insecurity and what could be causing it on an international scale, this is a great example. Next slide, Maria. And then just for Cincinnati, I was surprised to find that around a third of families suffer from food insecurity. And so I really wanted to know, why is it higher than the national average, which is around 22%? So a study was done, and these four factors were pretty much the dominant force behind why it's higher. But essentially, reliability on cheap, energy-dense foods was a reason why there was food insecurity, and then people were more likely to purchase food from convenience stores or food pantries rather than supermarkets, which could be lack of access. And then public transportation. Uh, a lot of people who are insecure or have food insecurity don't have access to transportation whenever they want, and they don't get to choose how long it takes them to get to the grocery stores. So that dependency kind of further like propagates the issue of food insecurity. And then priority, it was found that between choosing rent, utilities, phone services, food was the last prioritized part of what families would go through. So I think these things have just made food insecurity a larger issue in Cincinnati. And there's, for the pictures, there's a couple of organizations that you can support to try and reduce food insecurity, but we will get into that a little bit later. So yeah, I'm going to transition it to Tripura.
Hi, I'm going to be talking about the Supplemental Nutrition Assistance Program, otherwise known as the Food Stamps Program. So basically, SNAP provides nutritional assistance for low-wage working families and low-income seniors, people with disabilities living on fixed incomes, and other individuals in households with low incomes. And in recent years, they've found that SNAP has basically helped reduce poverty by a lot because it's able to help families channel their resources into rent and education and other utilities other than food, and while still getting the amount of food that they need. And it's also been really interesting to see, you can see on the graph here, that in recent times, the SNAP participation has like skyrocketed and almost reached as many people as who require it, to people who are in poverty. So that's really interesting to see. There have been oppositions to SNAP in the past in terms of cost and in terms of fraud. Maria, could you go to the next slide? But these graphs are showing that the cost of SNAP is reducing actually, because as more people are getting out of poverty, they don't necessarily need SNAP anymore. So they're able to kind of leave that. And on top of that, SNAP fraud used to be a big problem, and that's the reason the cost of SNAP used to be so high. But once they transferred to an electronic system instead of physical food stamps, the fraud has reduced from 4 cents to $1 to 1 cent. So the cost has been decreasing and decreasing and decreasing. So it's an overall great program that's going on.
All right, so we've given you a pretty broad overview now of just the kind of conditions that can lead to food insecurity in a developed urban area like Cincinnati. We're going to break you out into rooms, just talk a little bit about what you see some of the effects of that are. Some of you may have seen food insecurity in your own communities. For those of you that haven't, maybe think a little bit about what that could do to the people living in your neighborhoods. Talk a little bit about what that might do to college students, because there are a significant portion of college students that do face food insecurity, and also start to think a little bit about how you might approach solving those problems. We'll get into that a little bit later once you guys come back. So Cheryl, if the breakout rooms are ready, you can send people out.
Do you have a breakout room doc that you want to share first?
Oh, yes, you're right. So I will drop this in the chat. So that link is going to take you to a folder with 6 breakout room docs in there. Depending on which number room you're in, go to that corresponding document and fill in there.